So I'm going to stop sharing and I'm going to introduce again Dr. Jennifer Ligabell. She is a medical oncologist here at Dana-Farber Cancer Institute, friend and colleague, and she'll be talking with us about exercise and risk. So thank you, Jennifer.
Thank you so much, Tari. I'm really happy to be here. Good morning, everybody. So I'm just going to share my screen here and bring up some slides about exercise. We had Dr. King's introduction really set the stage nicely for exercise in breast cancer. And I'm going to dig a little bit more deeply into that, a little bit about why we think exercise reduces the risk of breast cancer, kind of how that works. And then at the end, I'll talk a little bit about what you can do. When we talk about exercise, what does that mean exactly? As we just heard, people who exercise regularly are at lower risk of developing not just breast cancer, but actually more than a dozen different cancers, which is kind of amazing when you take a step back and think about it. Cancer is a very complicated disease, and we know a lot about lung cancer is different than breast cancer, is different than colon cancer. So it's kind of amazing, actually, that something like exercise could be linked to a lower risk of so many different cancers. But we're primarily talking about breast cancer today, and I'm going to really focus in on the links between exercise and breast cancer. And I think the other thing that really, as the data have emerged over the last years, it's become really clear that although there are different kinds of breast cancers and there are different risks for cancer in younger and older women, exercise really seems to be linked to a lower risk of all kinds of different breast cancer. So breast cancer that arises in women before menopause, exercise that arises in women after menopause, hormonally driven cancers, hormone receptor negative cancers. So I think what we really see here is this really global relationship between exercise and lower risk of developing breast cancer. And so one of the things that I think is so exciting about working at a place like Dana-Farber and the Brigham is that we don't just stop at seeing a link, but we really want to delve into, well, why would exercise prevent breast cancer? What is happening in the body when somebody exercises that could actually explain how cancer is prevented? And this is important because this lets us figure out, well, which patients are most likely to benefit from this. It also helps us figure out, well, why do some people who exercise still get breast cancer? And so I think that this is something that we really learning more about the biology here can help us figure out how do we really apply this as part of a breast cancer prevention strategy. So I'm going to start with talking about a study that we did a long time ago now. So we really started studying the links between exercise and breast cancer now about 15 years ago. And we started with studies that actually enrolled women who already had breast cancer. And this was the first of these. And what we sought to do was to take women who'd had breast cancer and who were not exercising them, and then to either put them in an exercise program or have them keep doing what they were doing, and then look physiologically at what changed in their bodies when they started to exercise. And we were really interested in looking at different metabolic hormones because we recognize that there's a strong link between metabolism and breast cancer. We know that there are kind of common risk factors for breast cancer and heart disease, and that things like insulin and blood sugar are one of the things that connect both of these types of diseases, but are linked to both types of diseases. So in this study, we enrolled about 100 women who weren't exercising, and then we randomly assigned them to an exercise program that involved both cardio at home, which was mostly walking, and then working with a trainer to do some strength training exercises, or to a group that we had continued to do what they were doing. And what we were able to show was in these women who had had breast cancer, if they took part in this exercise program, it improved their metabolism, their metabolic hormones. So their insulin levels went down, levels of other growth factors went down, their blood sugar went down as a result of this exercise. And so we took this as a promising early sign that exercise was actually having an effect on the physiology of people who'd had breast cancer. So then we took this a step further, because we were interested in, well, we understand now that exercise kind of affects the whole body, But what's happening? What does exercise do to a breast tumor? And so again, this was a study that we enrolled women who'd already had breast cancer and in fact had just been diagnosed with breast cancer before they had even had their surgery. It was called the Preoperative Health and Body, or PREHAB study. And so we enrolled women when they were first diagnosed with breast cancer. And then again, we randomly assigned them to an exercise program. And in this situation, we really wanted to give all of the people that enrolled in this study some kind of program that would be helpful to them, because this is a stressful time and we wanted not only to study some of the physiologic changes, but we wanted to see if we could support people better. So women were either put into an exercise program that was very similar to the last one. They did aerobic exercise at home, they did strength training with our trainer, or they took part in a mind-body relaxation program. So in this study, we were really interested in looking at, well, how does exercise affect the breast tumor itself? So we did a biopsy before the patients started the programs, and then they had their surgery at the end, and we took a little piece of tissue from the surgery. And then we were interested in looking at, are there any changes that happen in that period of time in the women who exercised versus the women who did the relaxation program? And we found first, like in our other study, that exercise lowered blood hormones linked to breast cancer. So this was very similar to that first study that we had done. We did find that there were some benefits of the mind-body program. People were less stressed, they were less anxious. But the thing that we were the most excited about in this study was that the women who had been put into the exercise group had some changes in their actual breast tumor in the period of time between this initial biopsy and their surgery. The immune system was activated. We saw that there were higher levels of immune cells, and that is, we think, a good thing. We're learning much more about immunotherapy and the immune system and breast cancer. And this was really one of the first times that in people, lots of evidence in mice and in rats, but this was the first time in people that there was really evidence of a direct effect of exercise on breast cancer in people. So this led us to the study that Dr. King talked a little bit about. We wanted to kind of take this a step further and say, all right, we can see that exercise changes breast tumors in people who already have them. What about changing the breast in a way that may make a tumor less likely to form by enrolling women who don't have breast cancer yet and seeing how exercise affects their breast tissue? So in this study, which was the Exercise for Breast Cancer Prevention in Women with Dense Breast Tissue, which we conducted in collaboration with the BPREP program, we enrolled women who had dense breast tissue on mammogram. And I know we're going to hear more about that later, but that is a risk factor for breast cancer. And it's one that right now we don't have any preventative strategies that have really been developed for women who only have dense breast tissue on mammogram without other risk factors. So they had to have dense breast tissue. They couldn't be exercising regularly. They can't have had breast cancer before, and they were not allowed to be taking any kind of hormonal medicines. And so with that eligibility kind of structure, we enrolled 30 women in this study. And now the study, as Dr. King said, was conducted now a few years ago. So we actually were enrolling women through 2019 into the beginning of 2020, which was not the best time to be doing any study. And the last 3 patients, unfortunately, kind of got caught in the midst of COVID. So we ended up with the paired tissue at the beginning and at the end from 26 of our patients. The average age of our patients was 47, and we had a little bit more than half of them were before menopause and the other half were after. Women took part in an exercise program. So all of the women in this study enrolled, they had a biopsy, and then they took part in this exercise program. This was 12 weeks long, so this was a lot longer than the exercise program we were able to do in the study where women enrolled right after diagnosis, because in that setting, you're trying to get to surgery really quickly. And in that situation, we were only able to do an exercise program for 3 to 4 weeks. This time, because women didn't have breast cancer, they took part in this program for 12 weeks. And again, this used the same structure of exercise program. So women were given an exercise goal for their aerobic exercise at home. And then they worked with our trainer, Nancy Campbell, who I know has participated in the B-Prep Forum in the past. She worked with patients twice a week to do strength training exercises. We gave women a Fitbit. We, at that point, were having women either exercise in our center or go to a local gym. And we tried to get them to do 180 minutes of aerobic activity and 40 minutes of strength training every week. So the women who enrolled in this study had a number of different tests that were performed, and some of them were to make sure that they were eligible, that they were at increased risk of breast cancer, and then the rest were related to testing the effects of our program. So at the beginning, we did a measurement of breast density through a mammogram. And then after women joined, they had a biopsy of their, and again, these were not patients with cancer, but we did a biopsy looking for an area that was more dense using an ultrasound. Women had their height and weight measured, their waist circumference, which is a measure of their adiposity. We asked them how much exercise they were doing, and then we collected blood. And we repeated all of those things at the end of this 12-week program. And so this was kind of the information that we collected from patients as part of this study. Well, the first thing when you're doing an exercise study that's important to see is, does this program actually help women exercise more? Because you can't really study the effects of exercise on breast cancer or anything else if people don't actually exercise. So we were really excited to see that women in this study increased their minutes of exercise by about 100 minutes of exercise a week. At the beginning, they exercised about 96 minutes a week. And again, we selected people that weren't already running marathons and things. We wanted women that were not exercising every day so that there'd be some room for improvement. And at the end of the 12-week program, we had gotten them up to 196 minutes of exercise a week. So definitely a pretty big change in their exercise level. So we were happy to see that. Now, I don't expect any of you to be able to read this diagram on the right, but what we did in the study was we looked at the genes that were being expressed in the cancer, because when a cancer is, in the benign, this is not cancerous tissue. When we looked at whether we were able to change the expression of genes in the breast tissue through exercise. And so we did these 2 biopsies, and on the right side, you see genes that are expressed at higher levels on the left at the beginning, and on the left side, you see genes that were expressed at high levels at the end. And we're not going to go into individual genes, but the thing that was exciting about this is that there were, in fact, changes that happened as a result of this exercise program over these 12 weeks. And so we are right now doing a bit more work in figuring out what kinds of genes there were and what the potential meanings of this are. But the thing that we were super excited about is that when we looked at which genes that were related to the, we were looking at which pathways were related to these genes, we found out that just like in our study where we enrolled women who'd already had breast cancer, that one of the things that exercise was doing was really changing the immune system. And this time, this was changing the immune system in precancerous tissue, in this dense tissue that these women had. We found that their immune system was more activated. There are other studies that have shown that the immune system is really important in determining if cancer develops or not. So this was a really early study, a very small study, but again, showing for the first time that exercise actually makes changes in tissue, but even before cancer starts. And so we're really excited that this work has led to more funding for a larger study where we're able to test this out in two groups of patients, one group that's exercising and one group that doesn't exercise initially. It's a brand new study that will be starting again for women with dense breast tissue, trying to better learn about how exercise may help prevent breast cancer by regulating the immune system and other pathways. So if anybody is interested in participating, the study's not quite open yet, but it will have a structure quite similar to the last one, where we're looking at the impact of exercise on these types of markers in precancerous tissue in women who've not had breast cancer before, but who have dense breasts. So I think, in summary, women who exercise regularly are at lower risk of developing breast cancer. And this is true really across different ages, different kinds of breast cancer. This is also true even at lower levels of exercise. So doing something is definitely more important than doing nothing. And although at this point we really don't fully understand how exercise could prevent breast cancer, I think studies like this provide us with some really important early evidence about the changes that happen, both kind of throughout the body and then really in the level of the area where cancers develop, the way that exercise can change the body. I want to just finish out by talking a little bit about exercise itself, because a lot of times we hear, exercise is important, we should exercise. Sometimes it's not really clear, well, as a patient, what should you be doing? And I thought it would be helpful to talk a little bit about an exercise prescription, because we think about prescriptions for a lot of things. And in fact, there actually are ways to prescribe exercise as well to help prevent different diseases as well as breast cancer. So exercise experts generally recommend using what's called the FITT strategy to design your exercise program. And FITT refers to the frequency with which you exercise, the intensity, the time, and the type of activity. So we're going to start by talking about frequency. How often should you exercise? Does it matter if you do all of your exercise on 1 or 2 days a week? A lot of times we call people weekend warriors when they work out really intensively over on the weekend, but they don't do much else all week. Or should you try to divide your exercise across several days? Most experts do recommend that you try to spread your exercise out over several days, both because you get more cardiovascular benefit that way, but also because you're less prone to injury. If you don't really do much all week and then you go out and do really intensive exercise on the weekend, you're more likely to injure yourself. So I think the other point here is start slow and steady. You're going to set yourself up for success more consistently that way. If you kind of go out and say, I'm going to run a marathon and start doing really long runs without doing the training, that can lead to injury and people get burned out and don't stick with it. So start slow, build gradually, and you're more likely to build a habit that you maintain. Another question that I get asked a lot is, is it important that I exercise so vigorously that I'm sore the next day? Or is more lower level exercise helpful? And, I think that the recommendations change, and there's a lot of interest in these kind of high intensity interval training. It's not really clear how much benefit you get from things that push you that hard versus more gradual. I think there's a lot of debate in the literature, but the general rule of thumb has been work hard, but not too hard. And I think, again, this kind of goes to the injury question. When you do things very intensively, you're more likely to get hurt and then not be able to maintain the program. We often talk about that you can talk but not sing as being a good level of aerobic exercise in particular, where you get yourself into a good cardiovascular zone. How long should you exercise is also a question that I get asked a lot. And again, like many things, there's not a clear right answer to this question. There's some evidence that shorter bouts of intensity exercise may have benefit, but again, the risk of injury might be higher. I do think that one of the things that you do get more benefit from sustained activity. So rather than doing a minute or two with breaks in between, trying to do at least 10-minute bouts of exercise are good for building your cardiovascular strength. And then the last part of the FITT prescription is the type of activity. Does it matter what you do? And I think that it's really clear from all the research that's been done that many different types of exercise can be beneficial. Both strength training, so lifting weights, can be very good for maintaining bone density. And then aerobic exercise is very good for your cardiovascular health. I think it is important to recognize that some studies have shown that even kind of moderate paced walking, if you do this consistently, are linked to a lower risk of developing breast and other cancers. I think it's important to engage in exercises that use your large muscle groups, again, to kind of maintain strength. Women do tend to lose muscle mass over time. So doing things that involve large muscle groups is important. But really, if you can, trying to find a mix of both aerobic and strength training exercise has benefit. But what I also often say when people ask me what's the best kind of exercise, the real answer is the kind that you're going to do and stick with. Because I think one of the most important things about exercise is the maintenance. And that's oftentimes in these very busy lives that many of us lead, is hard to find something that you can stick with. So if you have something that you enjoy, you're more likely to keep doing it. If you can, there are different kinds of exercisers. There are people that are individual exercisers that really enjoy exercising on their own. And then there are people that really, really find a group setting to be something that's motivating for them. So trying to figure out what kind of exerciser you are, and then making sure that you set yourself up with success. So if you are a group exerciser, having those people around you that keep you accountable. If you're somebody that really enjoys doing this as a solo activity, making sure that you carve that time out so that you can do that. And the very last slide, I just want to offer, I am also the director of the Zakim Center at Dana-Farber, and the Zakim Center is a center that provides integrative medicine and healthy living programming for patients at Dana-Farber. Through the pandemic, we started an online platform that has a lot of exercise and nutrition programming that's really focused on cancer prevention and control. There are parts of the program that you have to be a Dana-Farber patient to be able to utilize, but there's a lot of parts of this that are public facing. There are now hundreds of on-demand videos about different nutritional aspects of foods and cancer, as well as different kinds of exercise programming, meditation and mindfulness. So this is available through myzakim.org. And again, we at this point have people that are joining these programs from 17 countries around the world in most states. So whether you're a patient at Dana-Farber or not, there's a lot of things here that might be helpful as you're thinking about how to incorporate healthy living into your cancer prevention strategy. So I'm going to stop there, and hopefully we've left some time for questions.
Yes, thank you, Jennifer. That was excellent. You did answer some of the questions as they were coming in, which was always fun. A couple of things though. One question is, what about water aerobic exercise? Can you talk to us a little bit about the difference between exercising in the pool versus on the land?
Absolutely. So water aerobics are a great kind of low impact way of getting cardiovascular exercise. They are not as helpful from a weight bearing exercise. So if you're thinking about maintaining bone density, but they're amazing for exercises that don't put stress on your joints. And so I think not necessarily as helpful from an osteoporosis prevention perspective, but great in terms of both building strength and really good way of doing aerobic exercise without the risk of injury.
And often, Jennifer, when we're talking to patients in the clinic, patients will tell us, well, I don't really exercise, but I stay busy around the house all day doing chores. I'm constantly, on the go, on the move. How should we help our patients understand the difference between being busy and actually exercising?
That is a great question. And in fact, there is a fair amount of research that's going on right now looking at avoidance of sedentary behavior, so not sitting basically. And there is also value of not sitting, which is kind of where you would put the busy around the house all day. There are studies that have kind of compared like sitting to the new smoking and things like that. I mean, catchy headlines. So I think that being up and around is important, but you get different benefits from more structured exercise. The cardiovascular benefits you tend to get when you're doing something consistently for more than 10 minutes. And strength training, you need to be using your major muscle groups, which often you don't if you're just kind of engaged in light activity. So light activity is important. It's definitely better to be moving than sitting, but you do get benefit from structured activity as well.
And someone's asking about the Live Strong program. Can you comment on that?
Absolutely. So the Live Strong program at the Y is a great program for cancer survivors. The program now has been in existence for a little bit more than 20 years, and initially was a collaboration between Live Strong and the YMCA. The YMCA largely manages it at this point. At one point, it was offered at more than 400 different YMCAs across the country. It has slightly different structures in many places. There's a little bit of flexibility, but it really incorporates both strength training and aerobic exercise. And it was developed to really be a place where people who've gone through a cancer diagnosis and treatment can come together and incorporate exercise back into their lives with people who've gone through a similar experience. So if you have had cancer and there is a program in your area, it's usually free, which is a wonderful thing as well to kind of help people get back up on their feet after cancer diagnosis.
Yeah, so it's important to remember, today, we're here talking about risk factors, talking about ways that we can take control and reduce our risk of developing breast cancer. But unfortunately, there are women that will do, as we say, all of the right things. They'll run every day, they'll eat healthy, but they still get breast cancer. And, there's none of our strategies are perfect, but we hope to, continue to learn more and again, help to reduce the risk amongst the population as much as we can. What do you tell your patients though, when they say, I've been running every day, I've kept my body weight normal, and, I still developed breast cancer, what now?
Right. And I think that's really important that we recognize that when you look at risk factors, you're kind of looking across a population of people. And when we say exercise can lower the risk of breast cancer, it means if you study hundreds of people, the people that exercise, a smaller proportion of them will get breast cancer than the ones who don't, but it certainly doesn't mean that nobody in that exercise group is going to get breast cancer. And I think that sometimes is frustrating, where people feel like I did everything right and yet I still got breast cancer. I do know from research that's been done, it's important to keep doing those things. There was a big study called the HEAL study, where they asked people about their exercise and their diet patterns. They asked them to remember what they had done before they were diagnosed. They asked them when they were diagnosed, and then they kept asking questions over time. And it was really clear that maintaining exercise patterns after diagnosis was really important to impact what happened next. That people who exercised more were less likely to have more breast cancer related problems. Again, it's not 100% guarantee, but it is something that continues to help people. And I think this is, again, one of the reasons why the research is so important. So we really understand what's happening when somebody starts to exercise, so that we're able to kind of look at, well, you're exercising, but this change isn't happening for you. Is there something else that we need to add in? Is there a different strategy? Is there some kind of diet piece that's important? Or there are a lot of genetic pieces as well that may be less affected by lifestyle. Although I will say that even in patients with some of the genes that I know we'll hear about later that lead to breast cancer risk, there is evidence that, for example, maintaining your weight, exercising, it may not completely prevent breast cancer, but it may make it happen 10 years later and be less aggressive than it would have been. So I think, don't lose heart. Please keep up healthy lifestyle habits. They're going to be helpful kind of no matter what happens, really.
That's great advice. And so just one last question. Can you remind our audience when you think your next exercise study will be available. And certainly we'll have it open through our clinic, but can you just make one final plug about the next exercise for prevention study?
Absolutely. And I realized that I should have put a slide in on this, but so we are hoping the study will open shortly after the new year. We are working out some kind of logistical pieces. I think that some of the training on this may be virtual training, which we're really excited about, making it a little bit more accessible to people. And you can contact me again. We will be enrolling patients through collaboration with the B Prep Clinic, which has really been such a strong supporter of our work. So we really anticipate early 2024 and would love to have anyone who might be eligible for that join us.
Great, yes, and definitely we will be sending you notices in our newsletter and other email blasts to let you know when that study does become available. We're all very much looking forward to it. So thank you again, Jennifer, for joining us this morning and for really providing such great information to our attendees.